Okay, so here today we have an interesting case. We have a young, vibrant 16-year-old young girl who loves to participate in sports and wants to continue her activities, but she's been completely sidelined and basically debilitated for the last 2 years because of severe back pain radiating down into her leg. The history of it is she decided to go for some kickboxing lessons, and in her first or second kickboxing lesson, what was it? First one or second one?
Second or third.
First or second kickboxing lesson, the trainer took her and just kind of tried to stretch you, I guess, or something,
yeah,
tried to push her. You can try to push her down to the ground and stretch her, which is the worst thing the trainers can ever do. And I don't know why they do it, and the yoga instructors still do it, and I don't know what they're thinking, but damage happens when you take a muscle or a tendon or a ligament or a joint or a disc and you push it beyond its normal physiological end range. Damage happens, and it happens over and over and over again. It happened with her. I've seen it so many times with women with weights and personal trainers. I just get tired of hearing the same story. But anyway, unfortunately, it happened with her. She did go to see a chiropractor a couple of years ago who helped her, but she didn't return to the boxing lessons, thank God. And she had some relief, but then last year, about 8 months ago, she started running, and suddenly, boom, she just was debilitated with pain again, and now she's got pain coming from in and around the L4-5 area, coming down through the side of the leg to the knee, not below the knee. So yeah, there might be some different opinions on this of whether it's a disc or not a disc, but from the sounds of it, happening as suddenly as it did, and with the pain radiations and whatnot occurring in the manner that they did, it sounds pretty clearly like a disc. I could be wrong. But if we look at the x-rays, then we are seeing what appears to be definitely some decrease in the height of the disc at L5-S1. Doesn't look too healthy, as well as the IVF spacing there is quite a bit less than the others. She also looks like she's got some loss of disc space in the upper part, and I asked her if she plays volleyball or whatever, but no. And then I asked about long jumping, said yeah, long jump and high jump she's doing because she has that kind of physique, so she'd probably be good at that. But that also sometimes takes its toll if it's happening during adolescence and the end plates are still forming, the bones are still forming. If we look at this area here with her, we can see clearly that there's an elevation here in this area where probably the pain is starting in and around this level. Is this the level where your pain seems to start, in here?
Yeah.
Yeah. So you can see this elevation. This is very common. You get this fat pad development where there's been some disc injury, where there's been some inflammation, and it's just sort of the body seems to want to protect itself and develops a little bit of a fat pad in that area. So now what we're going to do is just do the testing here. Pain here?
Yeah.
Immediately, eh? Okay, what about when we go left? Pain there?
Not so bad, but a bit.
Okay, going farther?
Like
farther left?
Farther left, okay.
Not so bad? So extension so far to the right?
That one doesn't hurt that bad, but it does a bit.
And going forward? See her, she starts to shake and vibrate.
Yeah.
You're feeling it there now?
Yeah.
Okay, quite badly, where, right in about here?
Yeah.
Point with one finger where you feel it.
I feel it in here.
Okay. Alright, so there's some pain going down into the left sacroiliac joint. Okay, standing up. Let's lift your left knee up towards your chest. Let's check the movement of the sacroiliac joint. And down. She's got a lot of cavitation there. The other side. And down. This side again.
This side again, okay.
And down. She's got a lot of cavitation in that SI. Cavitation meaning a lot of crepitus or sort of clunking sound and feeling in that sacroiliac joint. So I'm just marking in the left SI here on this chart. Look at me with your eyes. Okay, look at me the other way. It looks like it's about the same. Look at me again. A little bit restricted to the left. You feel you can't see me as well to the left, or is it about the same? Let me see. Nah, not much. About the same, right? Okay, so. Yeah. Alright, so you got a little problem right here. You feel this bone right here?
Yeah. Oh.
That's quite painful. More on the left, yeah?
Yeah.
Right there. It's quite painful there, isn't it? Yeah.
That one's really bad.
Yeah. So that's just, her L5 is rotated to the left substantially. It takes many years to develop the skill to be able to just sort of go inside the spine and feel exactly what's going on, but we used to practice years ago with a hair and a phone book, and we would put the hair under different pages. Finally we'd be able to feel it under maybe, you know, that much, believe it or not. But anyway, here, this one's also feeling painful here, isn't it, on the right side, right there. So what's happening is the lowermost segment is rotating to the left, and the one above it's rotating the opposite direction. So she's getting a shearing effect of the nerves in the middle. You feeling pain now anywhere?
A bit from here.
You feeling pain there, just in the leg?
Yeah, but it's not that bad. No, it's just the muscle, I think, it's
It's just the muscle?
Yeah, oh, that one hurts.
What did that do when I did
that one from here, actually.
Yeah, from down there.
Oh, and
That hurts when it comes down. Okay, hold this up for me. Hold it up hard, hold it. Turn the leg out. Hold it up, hold it. Okay. Just relax. Hold the leg way over here, toward me, out. Keep it out. Hold it out. Turn your foot in. Hold it in, hold it there up, push it up, and relax it. So the myotomes are working. Hold it out, push out to the wall. Strength is there. On the right side, push in. Left side, see anything, nothing, braggarts, negative. Hold it hard, hold it up hard, hard as you can. Iliacus, hold it. Bring your leg way out here, hold it up. Psoas, turn it. Psoas is a higher nerve root level. Myotomes are okay. You don't have any numbness anywhere?
no.
Okay, alright. So if we look at the leg lengths, we see significant discrepancy here. Right leg is about at least 1 centimeter longer. Maybe 1.5 centimeters longer than the left one. Big difference between those two. You have to really film it from up top here, straight down. And you can see it better. Okay, so that means that the pelvis is rotated forward and extended on the right side, and the left side is flexed. It's rotated backwards. So what I'm going to do is I'm going to lengthen right now this external rotator. I'm going to just see if I can gently balance the hips, the pelvis, and see if I can just move the L5S1 or the L5 vertebrae just over a little bit, see if I can give her a little bit of relief. And then we're going to suggest probably some non-surgical spinal decompression. The last thing we want for this girl at this age is to have to go for surgery. So, and I'm going to come up through the ischial tuberosity. I'm going to drive up through here and bring through the L5 at the same time. So I'm going to do a combination. Hold it there. No. Oh, I got a little bit of it. Phew. This one's probably not going to cavitate too much, but it might just a little bit. I'm just trying to try to go a little bit up, but I don't want to do too much here because I may compress the L5S1 nerve if I do it too heavily. So I'm going to try to take it from way up a little bit higher and see if I can just use a body weight, but I'm not going to go any more than that. If I do anything more than that, it's potentially dangerous, so we don't want to do that. But we did get a cavitation. We did get a little bit of movement. You felt that bone move a little bit?
Yeah.
Sometimes it only takes a little bit to make a big difference. So let's just see if there's a change now. Let's sit up. Before she couldn't bend forward at all or come backward at all. Let's see what happens when you come back now.
It's better.
Much easier, yeah? What about forward?
Yeah, it's a bit easier.
Okay, come back. Good. All right, so she's not shaking as much. She definitely came back into extension a lot more. She's guarded still going down, forward flexion, and I wouldn't be expected to still be because she's had a lot of sudden pain and she doesn't want to have a sudden attack again. Anyway, I think that's going to be it for today, other than the fact that we are going to suggest for her that she probably undergo some spinal disc decompression. That's good for the sacroiliac joints anyway. Even if there wasn't an actual disc herniation there, it would still be good for her because there is some compression definitely of the disc spaces. So we're probably going to suggest this for her as a way to go to prevent further problems like her mom's been having all her life, so she doesn't have that. So we can make some kind of a more permanent change as well during well, she's probably more or less grown the full height that she's going to grow, but the bones don't actually fuse completely until the age of 19 to 21. So we can still make a change, more dramatic change at the age of 16 they're going to be able to do at the age of 26 or 36 and so on. So that's basically it for this young lady with what looks like a disc problem here today in Tallinn, Estonia. This is Dr. O and the Dr. O Show. Thanks a lot for watching our Trigenics video today. Make sure that you subscribe to the Trigenics YouTube channel so that you're always sent information on the latest Trigenics techniques and methods, as well as the latest Trigenics success stories. This is Dr. O and the Dr. O Show.